Hello and welcome to a very special edition of Talk Therapy. In fact, this is a three-part series that has been some time in the making. We are calling it Cancer Conscious, and I think it's very, very critical that we place a lens on the impact psychologically that cancer has, not just on the individual inflicted with it, but also uh, the concentric circles of caregivers and people around that person and the ripple effect. And so we are starting with dialogue one, which is minding cancer. And for the entire series, it is an absolute privilege for us to be joined by Hiba Siddique, who is the oncopsychologist at Max Healthcare in New Delhi. And ever since I discovered that she exists and that she renders these absolutely invaluable services, I've been hounding her, and she's been very, very patient and
Mhm.
understanding and accommodating, despite a very busy schedule and lots of professional and scholastic academic work going on. So I'm truly thankful and grateful for her time, and I would like to welcome her. Welcome, Hiba.
Thank you so much, Karthik. It's a pleasure. Gone through your work and definitely looking forward to all the parts and co-learning in this space.
Wonderful. So let's dive straight in then. And uh, forgive me, I'm going to ask you potentially some very, very silly, rudimentary questions, but bear with me. And I would love for you to begin by talking a little bit about the impact, both, sort of micro and macro, that uh, any kind of cancer has psychologically on the patient itself?
Well, I think that's a very loaded question, to be very honest. But of course, if we look at it in a concentric space, we're looking at it at a level where, at a micro level and at a macro level, what are the different primary, secondary, and tertiary spaces that as people we are part of. So if we look at an emotional timeline, we look at patients or people who are experiencing cancer or have experienced through the time of diagnosis, um, and through the period of survivorship and recovery, and also palliative care. And then comes a point where, if we are looking at end of life treatment as well as care, the emotional aspect and the impact lingers on.
Hmm, hmm.
Going from there, there are obviously many kinds of psychological responses to a diagnosis or even treatment. And in no particular order, many times we encounter people just completely aghast, completely shocked as to how did this happen to me? I'm eating
I'm
right.
terribly sorry. It's a bad habit, but I'm going to come in and just for the benefit of trying to simplify this as much as possible for lay people such as myself to understand, and being a cancer survivor myself, would it be fair to say that in a lot of ways, what one experiences is actually quite similar to the grieving process, because the state because I think you were just going to start to sort of elaborate on that. First and foremost, in a lot of us, there's denial, and there's that why me syndrome.
Yes, I was coming to that, that in terms of psychological responses, there's an array of responses. So where you have some people or even families completely shocked, there are also many people not willing or not able to accept that something like this can happen. And you're right in saying, when it comes to, but why me? I've eaten right, I've done everything right, I exercise well, I'm young. So how and why did it happen to me? And subsequently, there are obviously the distress levels that rises in terms of the restlessness or the anxiety or even just, the fear that sort of clouds you in a way where even if you have sore throat, your mind goes to, okay, I might die tomorrow. And that kind of intensity of emotions is something many people don't deal with.
Mm.
It's a crisis. It's like how all of us tried to attune ourselves during COVID. None of us were prepared. We didn't study in schools. Similarly, when we look at health and medical psychology, which is the larger umbrella in which my subject comes in, we are also looking at it from a perspective of the variety of emotions that come into the person given their subjective reality. So, your and my reality might be very different, but we might be diagnosed with the exact same thing. But how I react and how you react may be completely opposite.
Absolutely.
And then going from there, there's something that I see a lot in my practice as well. And over the years, over a decade and more, maybe, that the impact that cancer has, and when going back to your question, when you look at a micro and a macro level, we're looking at my identity, my idea of self, who I am. So, what I was and what I've become and what I will be is also a very pre cancer, during cancer, post cancer me. It's interesting and very and I'm always very curious when people tell me that I wasn't like this. I'm not quote unquote this weak. I'm not so VP. I used to be such a fun person. I used to laugh, and I said I don't expect you to laugh in on your first day of cycle either. What kind of pressure are you coming with? So the impact on your identity, your self-worth, your body, your your understanding of sexuality, which we'll pick up obviously in our next segment, but that's something that's my niche area of work as well, that your understanding of how my body is also changing, my face is changing. Basic things that I identify with, the choice that I didn't make to be here, is also leading to a certain sense of existential distress.
Absolutely. I
So,
mean,
yeah.
sorry, please go ahead.
So is it micro, but is it macro as an impact? Both. So
Hmm.
existentially, if I don't feel comfortable with who I am and what I'm becoming, the whole idea of here and now then shifts to what is my future? What next? I don't have a present anymore. And that's how a lot of people, their families, end up making meaning. The uncertainty, the grief that you mentioned earlier. Uh, is also about, I don't identify with this me. I was fun. I was such a life of the party, and now I don't feel like talking to anyone. And those are the existential processes and impact on what it does to people who are diagnosed and experiencing it. And of course, when we look at the short term leading to a long term mental health impact, then of course you may have chronic depressiveness, you have survivor's guilt, that the friend that I made in daycare couldn't survive because their illness was, unfortunately, the same treatment did not work well on them, or the fact that I do have post trauma from the kind of care I went through, to an extent where sometimes when on the road, if you're driving or you're crossing and you see the board of the hospital, a lot of times people are like, it starts inducing
Yeah,
panic
it
even after
triggers,
five
yeah.
to 10 years. It triggers. So I feel like this is what I would look at as an impact on patients, I guess. I'm happy to pause if you want to
Yeah,
add something.
this, I mean, this is so vast, it's almost impossible to navigate it in a structured manner. And there are so many thoughts bombarding me. When I was having my interaction with Dr. Kanika Batra, she talked in detail about how specifically with women and with gynec cancers, there is that entire identity crisis that happens because you may not be in a situation to conceive a child, and all of those facets. And then, as you very correctly said, not only is there a deep sort of question mark on the self and who you were versus who you feel that you've become and may become. I remember when I had my total thyroidectomy and I came to, and I was in my room, and my endocrinologist came to see me. I wept like a baby in his arms for an hour because I kept telling him that, Doc, my daughter is 2 years old. And, what if this goes south? What happens? So there are so many layers and facets that can cause that stress and distress and those question marks regarding the future, that it's really complex. Um, Talk a little bit, I know it's so difficult to compress, but let's talk briefly at least about the caregivers in the same sort of space.
Well, I think this is one of my pet dialogues with every single family I may have met, that cancer is not a diagnosis for one person. One person gets diagnosed and the whole family gets diagnosed. And I feel that, like, fundamentally, I do feel how cancer can be so draining as well as consuming, and also team effort. But I think the impact that I see a lot on caregivers is many times both silent and very loud.
Mm.
The silent part again comes in the emotional burden and the burden of care that you carry on, thinking that I'm not the ill one, so I'm going to go out of my way to to help the other person. And a lot of times, we find people with family members or friends even very helpless. That the first part and the first thought that comes in is, am I going to lose this person? So the anticipatory grief is what we call it.
Mm.
Many times it's about even before your treatment has started, when there's treatment, like you talked about yourself, there is recovery, there's all of that. You start feeling the anticipation of losing a part of both me and my relationship with my family or my friend, and what this particular experience is going to do to the both of us or all of us, whoever there is. And when we talk about the identity part, there's identity conflict there as well, because your roles are now either overloaded, your roles are reversed, whether you've been a breadwinner to a part where you're a homemaker and a home carer and you take care of the home, to suddenly I'm
Right.
doing
I mean,
everything.
in any scenario, you are severely compromised.
And your relational aspect is also very, very dented because it's constantly being hit again and again. So when we look at the role overload, when we look at the identity conflicts that arise, naturally that comes from whether you're balancing work, you're able to even have self-care. Something as basic as, I haven't met my friends because so and so family member is ill, and I just want to go out and not talk about cancer, I don't want to talk about blood tests, and that particular thing feels such a mammoth like task for them, because they feel so much guilt that if I leave someone who's not able to enjoy food because of the impact of chemotherapy or the medication, how do I get to have a pizza? Or how do I get to have something, like a street food or
Sure.
chaat or whatever? And that kind of guilt adds on to a lot of frustration. And therefore, we often find caregiver burnout and fatigue, where
Hmm.
you may
In fact, I
notice.
want to very quickly add and rather check with you that there is again this the sources of building frustration and aggravating frustration are numerous. These a lot of things may not consciously occur to family members and caregivers at the time for various reasons. You're in an adrenaline rush and your priorities are different. But I think over a period of time, even things like the financial drain and the burden and the resources of the family that have been plowed into that entire treatment and process, resentment, anger. In my case, although my clinicians told me, hey, that wasn't the case, but because I've been a heavy smoker, the moment it was diagnosed, my wife and I were completely on different planets, because I was in this why me thing and she was in this ye to hona hi tha. So, there are so many conflicts that take place.
Absolutely. And I think financial toxicity can really, really ruffle a lot of feathers within the families, because this was not the plan where, say, I spend my savings. This was not the plan where we were supposed to take a vacation, and therefore this goes. And yes, you're right. And that's the silent suffering that comes up in both the people, where sometimes there's lack of acknowledgement, there's lack of support, there's lack of just empathizing with the person, even if it's, say, a cancer because of habitual reasons. Primarily in tobacco or smoking and alcoholism, we see that where there's a lot of anger. You're right. There's resentment that this wouldn't have happened if, and there's so much beyond the if, because there's so much of long-term emotional toll, because the same post-treatment stress that we talk about, it's like I did it once because I have the energy, I may have the resilience or the means to do it, but God forbid I can't do this again. And that, does that make me a bad partner? Does that make me a bad mother? Does that make me a bad father, or a parent or a grandparent or a sibling, to say, okay, I cannot do this anymore? So obviously the fear of recurrence and the subsequent anxieties with it end up rising by multifolds. And that's obviously not very nice for the carers as well.
And of course, I mean, in all of this, in the past 14 minutes now, we've just about sort of made a passing mention of the fact that what if that the patient does succumb and meets the worst fate? We've not even sort of gone there yet. This is all presuming that treatments are successful and there's a sort of a life post the disease. I know this is very easy to say, and I find myself bringing this up in so many conversations with mental health practitioners. Obviously, when one is undergoing some kind of distress, particularly such severe distress, there is a loss of objectivity. There is a loss of you kind of become divorced from reality in a lot of ways, because you're in this vacuum and like a zombie almost. And I think that might happen with the patient as well as with the primary caregivers. And the reason I mention this is that in that scenario, what are some sort of, I don't know what to call it, even safeguards or steps that the patient and or family can take in terms of their mental health, and to whatever extent it can be preserved? And also, I find, and I may be wrong, but there are very, very few, if any, people such as yourself. So in that scenario, do they go to quote unquote a regular therapist? What can one do really?
Well, I think the first part is to recognize and orient yourself to yourself. Where if you recognize, when a lot of people, they use the terms like, I'm not normal anymore. And I said, but what do you mean? I don't expect in this very abnormal experience to have a normal reaction. I don't like to use the word normal and abnormal, but okay, if you're mentioning, so let's go with it. But what do you mean by I was normal? Or when I get normal, this is how it's going to be. So recognizing signs of mental health strain early on is very important. Whether you tell your treating physicians, oncologists, or even the psychologists that visit, it is important to say that it's okay, I'm not okay. Is it a predisposition? Is it the impact of pre-op, post-op, or chemoradiation based changes, chemical changes impacting the mind, which happens, which is very common? Is it, and to have that emotional literacy, to know that, okay, I can name feelings. I am sad today does not make me a sad person by temperament. I need to seek help because I'm feeling really negative and I feel like self-harming, and that's not a nice thing. I'm crying for the first time in my life, but I'm not supposed to. Why not? What is it that you associate crying with? And of course, when you communicate, when you create that space for emotional sharing, it allows different aspects and different narratives to come in. So whether you go to a psychiatrist who prescribe primarily medications in India, and then you go to a psychologist, a counselor, a psycho-oncologist who are specially trained for cancer care, but not every place has it. So if you have somebody trained in mental health or crisis or trauma, you can actually go to any psychologist who is trained, who has the understanding of how to hold space for you and to be able to put yourself out there. A healthy practice is that we realize that somebody's domain might be covered with somebody else. So, say, for example, if a very small child comes to me and I've dealt with children many years ago, I would rather refer them out to a child therapist who are more in tune. Similarly, if somebody recognizes, then they can send them to a psycho-oncologist, a trauma-based therapist, or a clinical psychologist for assessment. So everyone has their domains. So to create these factors and that space, so when you seek therapy, when you talk, when you find routine and rhythm, you're also looking at red flags in your behavior, mood, functionality. Your family members can point that out. And that's where professional intervention comes in. So, to know when to seek and what to seek is your important go-to points. So who to turn to? We've covered that. You're looking at what does therapy do? You're just talking only. And I think that's also the stigma that not stigma that why should I pay to talk?
Right.
And the part is that there's processing, there's scoping, there is resilience building in a process, which is so shocking for everybody, all stakeholders involved. There is pharmacological support. You can go to the psychiatrist, your own physicians, oncologists can shed light into, okay, let me refer out my patient to somebody who will, somebody who can help them better.
Right.
And when we integrate mental health care in cancer care plans, that's where the holistic multidisciplinary care works. That's what we do at Max as well. And that's what makes it easy for maybe a Dr. Kanika, because she's you've mentioned her, and another medical oncologist or a radiation oncologist and myself. We also have a geneticist. We have a pain and palliative care specialist. For all of us to see the patient in a way that, okay, I've done my bit, but this is what we're looking at. I think so and so needs your help more. So we try our very best to work as a team in a way where with keeping confidentiality in mind, keeping the patient as the center, we look at, okay, this is the genetic diagnosis that's given to the family and they're devastated. So I've referred them to you for psychological care before they go and opt for surgery, medical oncology reference, and then subsequent radiation that follows. So we come together in that routine. So I guess this is something that people can do. And of course, there are lifestyle management techniques where, you have pockets of joy and normalcy that you acknowledge. You set boundaries where you feel you can't do it. Hear your body. Don't overdo it. Support systems really, really work. We have amazing support groups that our own people who have survived the illness many years ago run it. They tell us, okay, no. As a patient, I would have never liked to listen to this topic. So let's be better. And we're so blessed to have people who are just so good at what they do. And we've become a larger team. So I think these are some things, mind and body practices, healthy eating and lifestyle. So I guess, this is something
you've sort of answered my next question in any case, because I would have asked you about lifestyle specifically from this perspective, because otherwise, one knows sort of the basics of certain lifestyle changes or incorporations that one should do. Finally, to wrap up this dialogue, and I must ask you, it's a slightly selfish question, but I think it applies to many, many families and scenarios. A family that is dealing with a cancer member and has children as well. Now, very often in our country, one hears terms like, अरे बच्चे बहुत resilient होते हैं, अरे बच्चे भूल जाएंगे, अरे kids will take it in stride, and things like that. I want to ask you categorically that, of course, children are not caregivers, but they are highly perceptive, observant sponges. And when they are seeing so much morbidity and this sort of gloom and doom atmosphere, and the parents crying and this, that, and the other for a sustained period of time, what kind of impact and what is the recourse?
That's a very interesting aspect, actually, and I should have mentioned children as well. But I think it's very interesting in the Indian and the larger South Asian space, in which how parents feel so protective of their children. And it's interesting when somebody says, my baby is going to come, and I'm like, well, how old is your baby? And they're like, 20 years old. And the protectiveness that comes in from the patients for their children in whatever stage and age of life they're in. You're right. Children, in fact, if I look at children under 16, under 15, also, or maybe younger, they're very, very perceptive because they know something's not right, but they don't have the right words to express. They don't know, I'm anxious. They don't know that something's off. They know it because their body can sense the vibrations around. But what
And
do we do?
I
So we
suspect
often,
that not only is there a deficit of actual physical language vocabulary, but there isn't a formation, even cerebrally, of an emotional understanding that can be articulated. I mean, I'm interrupting, but I'll tell you, I have no qualms in sharing the genesis of this question. When I was in hospital, I was desperate to see my daughter, and I would keep telling my wife, get her. And she would keep saying, no, 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 out of the question. And then, of course, she finally succumbed and said, Acha, theek hai, I'll get her this evening or whatever. And, I wasn't physically any different. I was looking the same. And in fact, I always looked this way, so nobody believed that I was the patient to begin with. That's another stereotype, of course. But even so, I remember, and these are some things that I suppose I'll never forget. And Krisha was brought into my room. She was 2.5 or something at the time, and she said, and she refused to come to me, and she said, "I'm scared. I'm scared."
yes.
And so, it's just obviously children are deeply impacted, but somehow, I'm not sitting here in judgment or to blame, but there's so much going on that, perhaps they are not the focus then during that time.
Yes, they're not because they also realize that, see, a lot of times children expect that attention because they've been getting it. But in a scenario like this, where something is bigger, more crisis oriented, has to be dealt with right here, right now, children do feel neglected. And the neglect is also a little bit more selfish, which as children we all are, that who's going to take care of me? So if my dad falls ill, what's going to happen to me? If my mom falls ill, who's going to feed me? Who's going to bathe me? Who's going to drop me to school? And questions are around that. You're right that there's no formal language to define that how nervous I feel internally, how scared I am. So children, sometimes they draw, sometimes they project it through their toys. So we have to watch out for those symptoms, those behaviors, and parents do help us with that. We do encourage parents to speak to the children in their language in terms of what we're looking at. Are we looking at needles? Are we looking at tubes? Are we looking at a hospital visit, multiple hospital visits? So if we are able to tell them that, we are able to also normalize or at least attempt to somewhat
Hmm,
normalize the
hmm, hmm,
experience for
hmm.
them.
Or at least remove the absolutely abject fear, or
Mm.
this demon that it tends to become. But so my worry is that sometimes these feelings tend to linger, and I mean like linger long, long ways, because now that same daughter who was 2.5 is 8, and she's absolutely touchwood fine. She's not somebody who's scared of hospitals or needles or any of that. But the moment Pui is unwell, or if I even sneeze, or if I even go to the loo an extra time, she's paranoid.
Thank you for sharing that. That is interesting how sometimes the body also holds the impact and remembers what a certain time period in my life felt like. It's interesting that, she's still so young, but that sense of fear of maybe not seeing you around at that point of time for maybe more than a day, what that looked like versus now when you're still vanished or maybe just spending a little extra time in a different room. And yes, they may get used to, like, okay, now I know the hospital, the doctors are not so scary, this is fine. They go to their own pediatricians very happily. uh, but is that a choice they had at that point
Yeah.
of time? No, neither did you or that child or their parents. So it's a circumstantial thing that brings it. But again, emotional literacy of the child, constantly checking in with the child, is also something we suggest to the families, that please know that no matter how intense or easy the care plan sounds like, just please check in with the
Hmm.
child.
Absolutely makes sense. The bottom line being that everybody connected with that individual closely is very much impacted, and really in what is a most unsavory and unfortunate development and situation, the best one can do, and one must actually try and do, is a certain amount of awareness themselves, and then acting on that awareness is really, really critically required. And I think that's a good, positive, and optimistic note on which to conclude dialogue one, unless you have something specific to add.
I don't. I think I've said what I had to. And I do feel that when we talk about cancer, there should be more conversations. We should be able to say cancer without hushing it or saying, oh, I can't see the big bad C word. It's a chronic illness because the treatment is long term. And that's why it's referred to chronic illness. A lot of times people hear cancer and they're like, it's end of life.
It's
Just
funny.
like
Sorry, please continue.
any illness, any chronic illness like diabetes, chronic kidney disease, heart concerns, pulmonology concerns, etc., cancer is an equally um, similar illness. But because it's less normalized and less talked about, even the media portrayal and other things, it just seems as a death warrant, which is what collectively as people we need to change, and we really need to shake ourselves out of that idea and know that there are so many people having dealt with cancer and continuing to live good quality and healthy lives, thankfully. So yeah, I
Absolutely.
guess
There's no
this is.
doubt about that. Actually, the only thing I was going to add in my sort of limited observation from a layman's perspective is that that
Hmm.
change is happening because, unfortunately,
Hmm.
when I remember when I was young and I was a kid, it was so rare, and therefore it was this absolutely mammoth thing. If you heard so and so family में so फलाने फलाने को cancer detect हुआ है, as opposed to a scenario today where you'd be hard pressed to find any family that you're interacting with not having somebody with cancer. That's how much it's sort of rampant and increased. And so, if anything, it should be more sort of normalized and not the very, very, sort of, yeah, death trap that it is made out to be. But yeah, absolutely. So thank you for that. It was very, very helpful, and I can't stress the need um, enough to seek help because it's really, really required. You've heard, of course, from the expert, and again, I reiterate, as a survivor, if I hadn't got professional therapy, I don't know how many of my relationships would have survived, honestly speaking. So please go out there and get that help. It's very, very essential.